The clinical bottom line is definitely one of the most difficult sections to write. It's one of the lengthiest sections, and for new CAP writers, I suggest the following structure, just to kind of give you a starting point. The first paragraph can start with a brief introduction to the topic. This is usually just a couple of sentences that give a little bit of general background. Sometimes if you have more to write, this could be its own paragraph, but typically it's just the start of paragraph 1, followed by a brief summary of the study's design and purpose, and a very brief summary of the study's results. So those 3 components make up paragraph 1. If you're not quite sure how to get started, that's a great start. Paragraph 2 needs to include your evaluation of the study's general level of strength, and it's fine here to use fairly general terms like just weak, moderately strong, or strong. It's also important to include your rationale for the level of strength. So this might include your discussion of some of the limitations, which could be things like sample size, setting, issues related to generalizability. And then second, the second paragraph can include a description of how the findings apply to OT. So it's important in the clinical bottom line that you make a clear statement of how a reader could actually use the information in practice. If you've taken a look at some of the published CAPs, you'll see that there's lots of variation. Some of them are quite long, some of them are really quite brief. For purposes of class and for generally the expectations of faculty later in the program, we're looking for 2 or 3 paragraphs in this section. It is typically the longest section of the CAP. You would like to limit or avoid direct quotes, so the clinical bottom line needs to be your own summary and analysis of the article. If you do write a sentence that needs a reference, and this would be, for example, in the beginning of paragraph 1 where you're briefly introducing the topic, and you might be including a statistic or some factual sentence, then it's important to use typical APA in-text referencing format, and you would then place the reference at the end of the clinical bottom line section.